in this place where it's trying to figure out how to make tough choices in tough economic times, and trying to decide what are the essential programs that we have to preserve while we take limited resources and spread them around to other things. I mean, it's a horrendous decision, but it's still a decision they have to make based on input from the people who put them in place to make those decisions. If we fail to speak out, if we fail to do anything about what we know and what we believe, they will fail us. All you have to do is look at the activity in the last few weeks around the Earned Income Tax Credit and realize the power of public will. So I would say to you that while the Early Childhood Investment Corporation is delighted to have contributed to be in this place today and is honored to have been able to make that contribution to be in this place today, that the work is really just starting. And that the Genesee counties and the Shiawassee counties and the Kalamazoos who yearn to be in this very same spot and are working right now on trying to get there, and all the others that will follow, need from us more than they need anything else. They need us to leave this room today, make a phone call, send an email, go on a Facebook page, send a tweet, whatever you have to do, but make sure those policymakers understand this is a profound day of change for young children in Wayne County. And we can make that happen for all children in Michigan if we just have the will to do it. Thank you for letting me be part of this momentous event.
Thank you, Judy, and thank you for reiterating the hard work of systems change, because as I look around the room, I see there's some folks here who have what I call the heel marks of collaboration are permanently embedded in their backs, but they're still here and they still rise. As I look around the room, I see there's folks who are part of such things as strange acronyms like HSCB, MPSCB, multi-purpose collaborative bodies. And many of us are nodding our heads, the ones with the gray in our hair, right? But what you're speaking to is that it is a long, hard way to get systems to begin to adjust themselves to the reality that we are all fragmented, and guess what? We really aren't working, and we don't work very well. And that means all of us. That means us individually, and that means us collectively. And sometimes what we need as systems is we need those champions. So I want to say one of the things you may not know, with ECIC, in the very beginning, they provided seed money to our Wayne Children's Healthcare Access Program work group. And if it was not, Judy, for your leadership and your belief that we were just as crazy as you are, as an advocate for children, we thank you, and I want to let you know how deeply appreciative we are of your investment for us. And when we had a little bit of seed money, and then we had another wonderful opportunity occur. And so here are our seminal events. In August, we had a retreat. Many of you were in that room. And at that retreat, we were sharing what we have learned from you over this past year. We've talked to over 100 folks. We did family focus groups. We probably bugged Tom and Maureen endlessly. And they are generous colleagues and partnered with us. And we drove up and down the 96 to Grand Rapids. And so we held a retreat to say, this is what we've learned, this is what we believe we can do. And there was someone in the audience there who heard us make that call. And we're really pleased to say that someone, and we've had at least two of those someones at the table with us, and those were Wendy Jackson, as well as David Fukuzawa with the Kresge Foundation. And we are so delighted that as they listened, they believed that what we were talking about was in alignment with what they want to put their resources in to create that system change. So we were invited to submit a proposal, and as a result of that proposal, we had our Hallelujah Day, February the 8th in 2011. And so we would like for you to carry back the good word that all of us at Wayne Chap and all of our partners, and people like Tony Harkey, I don't know why you're sitting way back there, as much as Tony has been a part of our efforts, we are excited about the transition and the ongoing leadership that ECIC has provided, and now the tremendous support and leadership that the Kresge Foundation is continue to provide as being our key funder. And while Wendy could not be with us today, we are very delighted. In fact, a new level of excitement because it's our opportunity to meet you as well. Laura Trudeau is the program director for the Detroit team with Kresge. And some of you may know that foundations they have their own level of bureaucracy and corporations, and you're always trying to figure out, now, what part is your portfolio and what do you do? But we are so delighted that, as Providence would have it, while Wendy could not be with us today, that you have an opportunity to come and share your thoughts and your vision for how the resources and the work of Kresge can support our work, and we have an opportunity to share with you what we're thinking. So with that, let's bring on this continuation of the meeting of minds. Would you please put the hands together for Laura Trudeau?
Thank you. I'm going to try to adjust the microphone before I begin. Thank you. I'm really thrilled to be here today. As Chris mentioned, he and I worked together in the 90s on a program called Family Road at Hutzel Hospital when I was in my former life at NBD Bank. I'm here today really representing our health team and our Detroit Community Development team. Wendy Jackson is a key person on our Detroit Community Development team, and David Fukazawa leads our health team. And as Jametta mentioned, the two of them have been collaborating a lot within Kresge around this concept of a medical home for children. And they have been supported in their discussions by Phyllis Meadows, who is our senior fellow at Kresge, working with the health team. So we have a lot of folks thinking about these issues. And it really is an opportunity for us to take one more step in a transition that we've been in for 5 years since Rick Rapson became our president, of moving away from very important work we did on buildings and helping individual nonprofits improve their facilities and their connections with donors, to now working more on what Rip likes to call the critical issues of our time. So David's focus on reducing health disparities and our team's focus on revitalizing Detroit and bringing residents of Detroit the highest quality of services for all the aspects of their life has been able to grow in that new environment. It's truly an honor today to participate in the launch of this Wayne Children's Health Access Project. Keep calling it no, it's a program, right?
It's both.
Okay. It's just a wonderful opportunity for children and their families. And as I was preparing the remarks, I was reminded of a quote from Nelson Mandela, who said, "Nothing is more important or reflects better on a society than how it treats its children." And I think that's something that we all need to keep in mind and ask ourselves and question ourselves about every day, and then really ramp up that commitment to our children. We believe that this moment in Detroit's history may be one of its moments of greatest opportunity. We really believe that whether Detroit will come back or not may depend on the services and the skills that we develop in our children and how we allow them to have the maximum potential from their lives. Our work is not just about physical transformation of the city, but it's about how we build human capital and how we reweave a new civic fabric. We're investing in the healthy development of children because it's a way for our foundation to ensure that Detroit is a city where children are safe, supported, and nurtured. The Wayne Chaff program will be a critical component to make that vision a reality. But we know that the first years of a child's life are the most critical. So in linking health and early learning, we accomplished 2 objectives of our program, which is to increase the opportunity for children to learn and also to allow families to grow and thrive. We think that we'll be able to use the pilot project as a way to spread the word into some of our other work at Kresge and make sure that high-quality primary care is accessible to all children and youth in Detroit and in the state, including those with special health needs. This work aligns perfectly with the new way we work at Kresge. We're really trying to launch a program that we developed in 2009 that we think of as an investment framework. I like the use of the term investment rather than grant earlier, because we're investing in 9 critical areas, critical building blocks for the future of Detroit as key components of our common life here. Supporting innovations in healthcare for children is one of these investment areas, but we have an ambitious agenda that includes major sustainability initiatives, cultural programs, and local business development and economic development. We're acting from our conviction that Detroit's vitality is fed by collaborative efforts such as these. We want to thank all of the partners who've been involved in this. What we bring to the table is just money. What you bring to the table is your hearts and minds. Thank you.
Laura, thank you so much. This is always funny. I'm always the short one in the group, so I got to do it. Thank you so much for your comments. And also thank you for reinforcing this notion that the foundation community, and I think it's fair to say, because there's several of you here, Jack certainly with Michigan's Children, the work that ECIC has been doing, is partnering with foundations to say, how do we more strategically align our resources, because it's a finite amount of dollars that are there. And how do we use those dollars in a way that we can reallocate them to get better outcomes? And we're all interested in not just what we do today, but what's the impact up the road. I'd like to, just before we move forward a little bit, a couple of the people have joined us. I think that one, I'm looking at the back of the room there, Gaylada Murray, we didn't introduce. If you could stand your raise your hand, Gay. Lada is part of our Great Start Collaborative Way and the liaison to our action team. Also, I want to acknowledge a couple other people that are part of our work. I will do this periodically. Susan Hooks-Brown with Southwest Solutions has been part of our Great Start team. And in fact, you know what? Second thought, when everybody's part of Great Start, just please stand. Our Great Start Wayne folks, would just please stand. And I'm going to give you a round of applause. Health Department who's certainly been a part of us and worked with us in terms of evaluation. And that is absolutely critical because we're going to provide results. But the only way that we know that we're going to have results is that we have data and that we have an ongoing continuous quality improvement process that enables us to reflect on, are we getting there? But let me stop. I've got to tell you guys something. The person that's getting ready to speak next, Vita Sharp. I think, Vita, you and I met each other. Well, we won't have that conversation. Okay. I now like to say things about, 100 years ago, 1,000 years ago. But I'd like to share this with you. The only way that we get to do many of the things that we do is through persistence. And that constant focus on the outcome that we want. And so I want to share with you that Vita Sharp, before she became the director of the Detroit-Wayne County Community Mental Health Agency, and that is an institution like most institutions in this country that are focused predominantly on adults, and those dollars are predominantly focused on acute and chronic diseases. But I want you to know about Vita. She's a kid person. She loves children. She loves babies. She loves children. And I get goose pimples because your predecessor was exactly the same way. Gerald Ann Adams was a babies person. $500,000 budget, and was always coming around saying, okay, how are we going to figure this out so we can put more money into primary care? How can we figure this out to put this into early intervention? Jametta, what's this early on thing? Be on that state committee so we can put some money into that. Well, you have stepped into those shoes, Vita Sharp, and you have filled them exponentially. And even in the midst of all of the cuts and slashes and gouges that have happened in mental health, somehow or the other, you have persevered, and then you have assured that you have great staff like Carla Nichols, the director of the Children's Initiatives, that we have Jason working with us now on our serious emotional disturbance initiatives, that somehow or the other, in the midst of all that,